Good afternoon, everyone. My name is Amy Whiting, and I will be discussing health literacy today and why it is so important. First, what is health literacy? The ability for patients and providers to communicate so informed decisions can be made regarding health. This cannot be achieved if patients and providers are not able to understand each other. That brings us to two areas of concern: communication with patients, and language and cultural differences. Often providers use jargon or big fancy medical terms that the average person does not understand. This leaves the patient confused and often overwhelmed or intimidated. At the same time, healthcare providers can also feel confused when there is a language or cultural barrier. So, why are these concerns? When communication between a doctor and a patient is done in a way that both parties can understand each other, it brings about better clinical outcomes, which will improve healthcare quality and safety. The patient will also feel satisfied after the appointment because they are able to understand their treatment instructions. It helps build and improve the relationship between the patient and the provider, as well as building trust. Here in Brownsville, our community is quite diverse. 35% of our residents were born somewhere other than the United States and do not speak English in the home or at all. We have 750,000 residents who are Black, Asian, and Hispanic. As mentioned earlier, these language and cultural differences can cause communication barriers, which in turn lead to reduced clinical outcomes and does not achieve trust or a good patient-provider relationship. Next, we are going to go through a short small group exercise. Our next slide will show dosage directions for a medication. I would like you to please read these instructions. You have 30 seconds. Was it as easy as you thought it would be? Why not? Well, first of all, it was typed in a font that makes it very hard to read. How many of you noticed that the words were written backwards? So now take a second and think about this. What if you are a patient who reads at a fourth grade level? Now, what if you could only read at a fourth grade level, but you only spoke Spanish? The previous slide gives you an idea what it would be like to read something that seems so simple as a healthcare professional. There are ways to communicate with patients that will help them understand, as well as helping you feel assured that they comprehend the information you have given. Two techniques that can be used are Ask Me 3 and the Teach Back method. The Ask Me 3 method takes 3 simple questions for the patient and their family to ask their provider. They are: what is my main problem? What do I need to do? Why is it important for me to do this? We as healthcare providers should promote and encourage this with all of our patients. We can do this by providing pamphlets in our waiting room, including them in our new patient packet, as well as handing them out to patients at the time of check-in. While the Ask Me 3 method puts the responsibility on the patient to better their clinical experience, the Teach Back method puts the responsibility back on us as healthcare professionals. After providing information or giving instructions to the patient, ask them to repeat it back to you in their own words. For example, if you've just explained to a patient how they should take care of themselves upon discharge, you can say to them, I want to be sure I explained your discharge instructions clearly. Can you explain them back to me so I can be sure I did? You may even find it best to do this in small segments as you are giving the complete discharge instructions. Be sure to try again if you feel there is misunderstanding by approaching the instructions differently with the patient. Rather than simply asking the patient if they understand, this method will ensure that they do. You can use this method when explaining anything to the patient and their family, including discharge instructions, new medications, or care planning. This concludes our training today. I appreciate your attendance and hope that you have gained good insight on how to have better communication with our patients. I encourage you to ask any questions if you may have them.